Broadcasting from Manhattan Beach and the World Wide Web, you're listening to CHSR, HealthyLife.net.
As a service to our listeners, this program is for general information and entertainment purposes only. CHSR HealthyLife.net does not recommend, endorse, or object to the views, products, or topics expressed or discussed by show hosts or their guests. We suggest you always consult with your own personal, medical, financial, or legal advisor.
It's time now for the Patty Conklin Show, exclusively on HealthyLife.net radio.
Well, hello, folks. This is Frenesa Hall, and Patty is off today. She's gotten covered up, and I'm so happy to have my guest, Melissa Blatt, founder of Indipop. All you folks out there struggling with health insurance coverage and the exorbitant rates that they're charging, this program is for you. Indipop is a curated healthcare marketplace offering significant savings compared to traditional insurance, and Melissa is going to share with us the details of that. But before that, first, welcome, Melissa, for agreeing to be a guest on my show today.
Yeah, great to be here.
So before we get started, because you have an interesting background, just share with us briefly what your background is and how you came to create Indipop.
Sure, absolutely. It actually came from my own struggle. When I left corporate world 5 years ago, I was faced with being now a 1099 contractor and responsible for finding my own health care. And as you know, in our country, it goes by your employment status, and with healthcare.gov, it can go by your earnings to see if you qualify for any subsidies, your zip code, are you full-time, are you part-time? And so I had high hopes that I can go into that marketplace, and, I saw the commercials. I thought, maybe there is a $10 plan. But that wasn't the case. And I ended up being quoted for, a bronze HMO with a $9,000 deductible, and it was, because I was in my late 40s, it was about $600 a month. And I was new to this. I didn't know. I was now responsible for my health care, and I was very nervous about, I didn't want to go without. And so what happened was it led me on this search of, what is out there? What is already in the market? And I kept coming up with insurance after insurance after insurance, and they all work the same until I learned about another model, which is, we can dive into that now if that makes sense, or do you want to stop me?
Yeah. Tell me what you did before, though. You want to know my background? What was your previous?
Oh, okay.
Yeah.
Okay.
Because just to get a sort of a whole picture of where you came from and then how you got to doing what you do.
Well, it wasn't a straight line. I actually studied film and TV in New York. I've always been a creative person. I did make my way out to LA and worked in entertainment industry for a while behind the scenes. Ended up in nonprofit, which I loved, and then ended up working in technology for the last, I'd say, 10 years. So, when people say to me, wow, how did you even start Indipop? Well, every, I think, opportunity or endeavor that I've had led me to be able to launch my company. They all of the moments added up to this one, and I'm exactly where I'm supposed to be right now.
I know that feeling. It's like each step, you don't know where you're going, but when you get to your next step, you see how the previous step prepared you for what you were going to do. And then you look back, especially when you get to a certain age, and you look back and you see all the little pieces that fell into place. And at least for me, I can see where, boy, if I had made this choice instead of that choice, it would be a totally different ball game. I'd be in a completely different place. But I see that here I am today, and, I'm happy with where I am today, and I think you are as well. But it's sort of comforting to know that even the difficult times that have occurred in the past and the hard decisions and so forth, have led me to where I am today. And so I can be, okay with some of those experiences that weren't so good. It sounds like you enjoyed the things that you did before, but, all of us have had challenges along the way. I
think the challenges give us the opportunity for growth in that even when I don't think of anything as regret or a mistake, because if you can learn from it, then that's giving you the opportunity where life can take you. The best scenario, or the best maybe analogy, is a road trip. The best road trips are the ones where you have the detours that take you to that pie diner that you would have never gone to because you would have just gone straight through on the I-10 the whole way through. And when you get taken off course, those are the moments in life that can be the most colorful and the biggest lessons, or that you meet a person that changes your life. You just never know. Yeah.
You never know. Or you find some just lovely little, cove or whatever. Or you, like you said, you run into people that you would never have met and maybe would never have spoken to other than that situation, and then you find some kindred spirit. And so I, totally relate to that. So what did you do in technology? What
I work for a CRM company, so almost any company or any small business owner is going to have a database that helps keep, their clients in a platform. And this particular company was a startup here in Arizona, so I really got to be a part of the growth of the company and work in all departments of the customer journey, which is really, it gave me a lot of insight into, the first, talking to a customer, the lead that comes in, to after a sale, to what happens, and all the different departments, how they can work together. But more importantly, it was a really great role model for culture of a company, because I think companies that have really great culture, and the employees are part of that culture, then they feel valued and they know what they stand for, and maybe they know their why a little bit more. So you might not just be selling widgets. It's why are you selling the widgets? What does it do to help the world or that particular person when you have this widget? What is your why?
Right.
What is your why of why you're doing what you're doing?
That doesn't seem to be the MO of a lot of companies, where the employees are the widgets, and, they're not valued in that way. It also sounds like that company gave you a lot of the tools and knowledge to launch Indipop, because all the things you have leads and customers, and obviously recognize that creating that inclusive culture where each person is valued for what they do, what they bring to the table, helps the entire organization progress and improve and put out a good product. And I think that from talking to many of my friends who have been in the corporate world and my experience in the corporate world, that's just not always the case. And you feel more like a pawn rather than having your contribution really valued. I mean, I know when I had my medical practice, every person in my practice was valued because we couldn't do it without them. I mean, every person played a role to make sure that the patient was taken care of. I think you reached out to me on LinkedIn, I think, or somebody, I don't know. And I get all these requests on LinkedIn, and some of them are just so lame, it's just mind-numbing. But when you reached out to me, it was at a point when my company decided that life insurance wasn't a business sector they wanted to be in anymore. And so my position was going to be dissolved in 3 or 4 months. And I'm thinking, my goodness, here I am. I'm going to have to go search for another job. I don't know what's going to happen. I'm going to get 3 months of health insurance, but after that, it's COBRA. And COBRA is ridiculously expensive. And I thought, there's got to be another way. And then, boom, you reach out to me. And I thought, I need to know about this because I might need this service. And then we got to talking, and I was thinking, my goodness, I know so many people who are self-employed. A good friend of mine's paying over $1,000 a month for insurance, and people who had, certain medications that were covered, and they had a reasonable copay, and now all of a sudden, $400 for their medication. I mean, there's all sorts of challenges out there that traditional health insurance creates, not to mention the, from a physician standpoint, mother, may I get this test for my patient? May I order this prescription for my patient? All this paperwork. And then on the patient side, just jumping through hoops to get things done and, all of these charges. So I had never heard of a health exchange. I mean, it was completely foreign to me. And I have to admit, I can't say that I totally understand how it works. But I think this is so valuable for people out there, particularly right now when there are going to be changes in healthcare, and there are going to be people that have been on Medicaid that are not going to have coverage, and they won't be able to afford the traditional insurance. And so I think that this is a really important topic right now, so people can see, well, maybe there is something out there that can help me and my family not just be left, at the mercy of the hospital. I think there's a big disconnect in this country in understanding, the real cost of health care, that, if people don't have health care, that's just their problem, blah, blah, blah. But it's a societal problem. When people don't have access to health care, emergency rooms become flooded and they're overwhelmed. And so there's inappropriate use of the ER because people have nowhere else to go, which means that when you are sick and you go to the ER, then, don't complain about a 10-hour or 12-hour wait. We did it to ourselves as a society. So, talk about, so the overview of what a health exchange is, and how that works.
Well, ours isn't a health exchange. Ours is healthcare membership. So if you think about Uber versus taxi, they're both taking you to you're getting to the same place you need to go, but you're using a different model to get there. And so you have the option to use insurance, and then you have this other alternative model, which is called a cost share or a health share. And that is a completely different model. So with insurance, you have the transfer of risk, you have underwriting, and then you have the ACA, Obamacare, where you're going to put in your employment status and your earnings and see if you qualify for a subsidy. Those subsidies then can reduce your premium, or you might even be able to be on Medicaid, which is, subsidized health care, so that you are not paying for your health care. Most self-employed Americans, especially if you're a 1099 contractor, believe it or not, over 32% make over $150,000 a year. They don't qualify for any tax subsidies, so what ends up happening is they're paying the most for health care. So for a third of the workforce, and as this workforce grows and more people are becoming contractors and not seeking benefits from a company, then this is where, how do we serve these people with health care? How do we serve the people with affordable, accessible health care? And that's where, so Indipop, it stands for Independent Population, and these are all the people that are not getting their health care through a company or an employer. and they're on their own to find and access health care. And what we did was create a marketplace of this alternative product in the market, because most Americans don't know that this model exists. And if they do, they don't know how to search, like, what, there's many out there. Why is this particular healthcare membership better for me than another one? And based on that, we can help match them. But we curated the best of the plans and put them into one place.
So you're the clearinghouse for the best plans, health exchanges out there.
Yeah.
Okay. And I think you said that you have 9 plans at this point?
Yeah, about 9. Mm-hmm.
Yeah. And this is available for individuals, for families as well.
Correct. So it's individuals, families, small business owners.
And what about prescription coverage? Because that's a big, hot issue. And obviously in this country, the cost of medications is ridiculous. I mean, we do have Good RX out there, and then the plan that Mark Cuban created. I can't remember the name of it.
Cost
and
profit.
so there, and so there are ways to get some of those costs down. Yeah. Are these exchanges affiliated with these plans, or do they have their own separate pharmacy coverage?
So many of the options do include a prescription benefit, and it is all about finding the pharmacy with the lowest cost. So if you know, like, medications you can go to a CVS versus a Costco or your local grocery store, and, well, why is it 24 here, 36 there, 54 there? Like, why does it range? Every day the prices can fluctuate, actually. So these plans also, have discounted pharmacy or prescriptions, and it really is an eye opener for people once you pull the curtain back of how our healthcare system runs. And a lot of times when you pay cash for something, it can actually be lower than your copay on it.
Right.
So yeah.
Which is kind of shocking. It's like, why would your copay cost more than the drug? I mean, it really is astounding, and I've actually seen that before, and and people wonder why, at least in this country, there's this big distrust of the healthcare system, because it's not working for the people, And I know when I had my practice, which was 1992 to 2002, something like that, some of the CEOs for health insurance companies were making $20 million a year. That's $20 million just for them. That's paid out of people's sweat from their premiums. And people ask me from time to time, what's your solution to the healthcare issues that we face today? And I think we have to take the profit out of it. These companies can't be on the stock exchange. You have a company on the stock exchange, they're beholden to their stockholders, period. The CEO is going to get fired if the stockholders aren't getting value for their investment. But that money is the lifeline. This is the money that people are paying out, and what fraction of that are they getting back? And so, I think more and more people, and it's probably going to be more people as we move forward during this time, are going to need some other solution, because you certainly can't afford to go without health care coverage, because the leading cause of bankruptcy for individuals is health expenses. You have a catastrophic event, an accident, a cancer diagnosis. Don't get me started on that. Where infusions of whatever, it's $40,000 a pop. I mean, that's not something an individual who doesn't have insurance can sustain. So, we have to have more options, and health exchanges, I think, are going to become more and more popular in the next years. And I wonder. I haven't done this, and maybe we should do this at a later time. But I wonder what my insurance that I pay right now. My insurer, my employer covers, a big part of my insurance, but I still pay a premium each month. I would love to sit down and compare what I'm paying versus what I could pay through an exchange. We do it all the time.
Yeah, we do it. We do this all the time. Yeah. Yeah.
And you see that the exchanges are often better.
So, it also depends. Okay.
We've got to take a break. We'll come back to that after the break. Thanks, folks.
Okay.
Hang with us.
Want to get that man or woman out of your mind? How about being in the right state of mind for getting that job promotion or staying positive to help boost your immune system? Want to break those old habits? Then it's time for an emotional cellular cleansing with Patty Conklin. You'll get a private 3-hour session in person by phone or by Zoom with 3 months of follow-up appointments, plus email support. But you'll have to do the work, and homework materials are included. Find out more or to book your appointment, visit pattyconklin.com. That's pattyconklin.com.
Audiobooks gives you instant access to over 50,000 of the best sellers and hottest book titles in romance, mystery, fiction, and many other genres. Just visit healthylife.net's advertiser page and click on Audiobooks to get started.
If you're wondering if Patty can help you heal, why not book a free 15-minute consultation either by phone or by Zoom? It's a great way to see which of Patty's services is right for you. You'll discuss her services in detail and how they can apply to your specific situation. It's really a great place to start, and you can sign up for your free consultation by phone or Zoom on Patty's website, pattyconklin.com. That's pattyconklin.com. Get the help you need today. Sign up for your free consultation at pattyconklin.com.
ASMC, the premier German company that supplies everything for adventure, from outdoor clothes to outdoor gear, even backpacks. Lots of quality and lots of specials. To start your adventure, go to healthylife.net's advertiser page and click on ASMC.
Okay, I get it. You're a doubting Thomas, and you don't want to pay for something unless you can know what it's all about. Well, now you can find out just what Patty Conklin's energy healing is all about. Go to pattyconklin.com to sign up for her free group energy adjustment, held every Wednesday from 12 p.m. to 12:30 p.m. Eastern Time. Experience for yourself the transformative energy designed to bring calm and healing to your life. Space is limited, so sign up now. Go to pattyconklin.com, click on Services, and you're there.
Where positive people and radio unite. HealthyLife.net.
Okay, we are back with Melissa Blatt of Indipop, the curated healthcare marketplace that is a option instead of the exorbitant rates from health insurance companies. And, and for the self-employed, the small business owner, this is something I really want you to pay attention to, because this can be the solution that you've been looking for. It could be a way to offer some kind of health benefits to your people. You have, 5 per people in your company. So let's just, if you would, take just a high level sort of overview of the health exchanges, and then talk about just the basics of how they work. And then later on, I'd like to get into how Indipop helps people and connect them with what their needs are.
So our marketplace, when you come to it, doesn't have any insurance products at all. You're not going to find the insurance programs. They're all called cost shares. We like to call or subscription-based plans because you're subscribing, you're becoming a member, and there's a big fund that's being managed, and out of that fund, there's shared amounts that go for your medical expenses. So some plans are literally just for high-cost medical, more of a catastrophic plan. Some have robust benefits like unlimited primary care, chiropractic care. So each one is a little different, and it's not a one-size-fits-all. So, we can help match people to the best fit according to, hey, I have a health savings account. Do you have something that's compatible that I can use for my health care? Yes, we do. I have a 26-year-old, going off of my insurance plan. Do you have something that's really low cost that can protect him from a high cost deductible for a broken leg? Yes, we do. So, that's basically, when you come to Indipop, you're getting exposed to these cost shares that then you have to decide, well, which one would work best for myself or my little small group that I'm, that I have. Does that make sense? Yeah.
Yeah, absolutely.
Okay.
And it's coverage for any age. So there's coverage for infants and children, for pregnancy. Yes. So how it works, we'll get into the weeds a little bit, but it's important, is 18 to 64 is eligibility. Once you turn 65, you go on Medicare. So yeah, you can be, 18, have a U.S. residence and enroll. We are not tied to open enrollment dates, which is really great because you should be able to join or enroll in a healthcare plan on your timeline, not just because it's November and open enrollment was offered. So we're not also your rate of your plan is not determined by your employment status or your earnings. So I can quote someone in San Antonio right now that might be interested in the HSA compatible plan. And he's in his 30s, it's $325 a month. Well, the same 35-year-old in Sacramento, it's the same rate, $35. I don't need to know, he doesn't even need technically to be employed, and I don't need to know earnings to say this is how much it's going to cost to have access to this healthcare membership. Now, there is something called pre-membership conditions, because if you can imagine, there is a big fund that is being managed. So if somebody came on the plan pregnant, then let's say 2 months later after she became a member, she gives birth, she put in 2 months of membership into the fund, and she's already using it. So for pregnancy, there is something called a look-back period, where if you are pregnant at the time of enrollment, it's considered a pre-membership condition, and it's not eligible for the cap of expenses that typically our plans would have. So the actual healthcare membership would negotiate the best cash pay rates for her. So in some cases, that can work out really great because in our country, pregnancy can range. It's so, with insurance, I've heard people pay $25,000 out of pocket. So now other conditions like diabetes or high cholesterol or high blood pressure, those can be excluded from this pre-membership condition if you're medically managed. So each plan works a little differently with their look-back period. But the good news is once, if you're in your second year of membership, almost 90% of, I think, of our plans will then share up to $25,000 towards that condition that you came on with. So the longer you stay on the membership, the more that they will contribute to your pre-existing condition. Okay, so let me just repeat what I heard. So you join, you're a member, and your payments go into a fund that is managed. And when you join, if you are already pregnant, that's a pre-membership condition where you can't give birth in 2 months and have only put in 2 months of into this fund. But I think you said that this individual would get help negotiating the best possible rate where they are to give birth, so that at a minimum they're going to pay the best rate and not just get hosed. There's assistance.
Yeah. In medical advocacy, comes with each one of the health care plans, because they are on our side. They're on the member side. They want you to get the best care at the right price. And many people do not realize, and I mentioned this with prescriptions, that even paying a cash pay rate for imaging could be less than your copay. And so this idea of fair medical pricing and knowing exactly what something should cost is really important. And I have found with some of our memberships that they actually can do the cash pay rate between $5,000 to $10,000 for a natural childbirth. Now, we do have one plan. It's very interesting. So let's say that you're 6 months pregnant, and you come on to the plan and you put in 3 months of membership. They will actually count that as part of your contribution, so the 3 months that you were on the plan, and then they would pay the difference. So they don't want to penalize you, they want to help you. But most of the plans will say, look, you're not eligible for that low out-of-pocket rate. And I can explain, by the way, did I explain the difference between a deductible and what we call an IUA?
Please.
I don't think I have. Yeah, okay.
No.
Deductible, I think we're all familiar with a deductible, is the amount you're going to be responsible for before the insurance kicks in. And what is it? It's tied to the calendar, the calendar year. So what happens in January? It restarts.
Starts over.
So if you broke your leg in December and you needed physical therapy or, a CT scan to see how that leg is healing in January, February of, let's say, 2026, what happens is your deductible started at zero again, and you have to it's like you're being hit. You have to pay for it twice at that point, because you're like, oh my God, I just hit my deductible for this broken leg. Our plans they don't have deductibles. They have IUAs, which is your initial unshareable amount. IUA, initial unshareable amount. The amount you're responsible for before the health share kicks in. And it's most of them are in increments of $1,000, $2,500, and $5,000. They're fixed. That is your portion. So let's take the $1,000 IUA, for example. You sign up for a $325 a month plan, and your max out-of-pocket for that particular medical need is $1,000 for the broken leg. You break your leg ski, you pay your $1,000, and then in January, you do not have to pay $1,000 over again or start paying for PT, physical therapy. It is included in the medical need. So the IUA follows the medical need, deductible follows the calendar year.
I see. Fantastic. Mm-hmm. Okay, we've got to go to another break. We'll be back, folks. Hang on. We've got more useful information for you.
Okay.
The pulse of the blood in your veins means you're alive, but a high or low pulse could mean you're not in balance, which could cause problems. But now, Patty Conklin has found 3 ways that can constantly make sure your pulse is kept in balance so you can move easier through life. Subscribe to Patty's Healing Pulse today. It has a plethora of things to do, discounts, book club, and so much more. Visit pattyconklin.com to find out more about Patty's Healing Pulse subscriptions. That's pattyconklin.com.
Reach your health and fitness goals. Whether you want to lose weight, learn to dance, build muscle, or just live healthy, Beachbody gives you unlimited access to the nation's most popular fitness and weight loss solutions. Visit our advertiser page and click on Beachbody now.
You may not be in the same room or even the same country, but Patty Conklin's remote energy work can help you heal whether you have an illness, emotional wounds, or are in spiritual turmoil. And she can do it remotely. You can choose your session time, too, starting from 30 minutes, 3 hours, or even 6-hour sessions. Healing energy. Healing you no matter where you are. Visit pattyconklin.com, scroll down to remote healing, and book your appointment now. That's remote healing at pattyconklin.com.
For the best in business class travel, count on Cheapo Air. Cheapo Air has the best price guarantee, 24/7 customer service, and easy booking online or by phone. To experience your hassle-free journey, start by going to HealthyLife.net's advertiser page and click on Cheapo Air.
If you're on PattyConklin.com, you might want to visit her store. There you can inexpensively buy powerful visualizations on a plethora of subjects, all to help you heal, help rebuild your immune system, work with color or tonal energy, help remove fear and depression, and so much more. Plus, you can get Patty's best-selling book at her store, To Be Your Best Too. God Within is a great book to teach you how to use the lost knowledge of the universe to impact your physical life today. Visit her store at PattyConklin.com. You'll be glad you did. PattyConklin.com.
Expanding your mind. HealthyLife.net.
Okay, folks, Frenesa Hall here with Melissa Blatt of Indipop. And just before the break, you were comparing the initial insurable amount to a deductible. I mean, we all know about deductibles, and, you know, it's the calendar year. So if you're, as you said, broke your leg in December, you're paying the deductible to get that surgery to fix it. Come January, you have to go to physical therapy for that leg. Bam, you're hit with that deductible again. So I want you to just repeat how the initial insurable amount works, because I think this is a really key benefit of health exchanges.
Yeah, so the initial insurable amount is a set predetermined rate that you, when you enroll or join one of these healthcare memberships, is you select. So just like the higher deductible, the lower your premium might be, the 5,000 IUA, it would be a lower monthly than the 1,000 IUA because you're paying more out of pocket for that 5,000 IUA. Now, how it works is it's by incident. So if I'll give an example of you have a family and you have kids in sports, and one of the kids breaks their leg in soccer, and you chose the 1,000 IUA. So for that particular medical need, that is a 1,000 fee that you're responsible for. Then 3 months later, your husband needs an emergency appendectomy. That is a separate medical need. That is $1,000 IUA, and that is capped at 3 of those in a year for high-cost medical. So we can say to a family, if you select this 1,000 IUA for the membership, the max high-cost medical that you would owe out of pocket would be $3,000 in a calendar year. That would be 3 separate incidents.
Okay. And if the kid broke their leg in December, that IUA of $1,000 is paid, and that is for the global treatment of that incident, that medical problem. So come January and February, they're going to physical therapy, you know, or whatever. They have to follow up, you know, you said MRIs or whatever. They're not paying that $1,000 again because it's not tied to the year for the incident. It's tied to the actual medical condition that's being treated. And that's a big difference because with you know, traditional insurance, your deductible is the calendar year. Come January, you're starting all over. So, yeah, okay, you're going to physical therapy, but you've got a $1,000 deductible that you have to pay again, even though you just paid it, you know, 3 weeks earlier. So that's huge. And then you're saying that you have 3 separate incidents in a year. You're saying that the max is going to be 3,000. So if the other child had some event, then after the other 3, then they wouldn't have to pay the IUA again for that fourth incident?
So again, we're speaking high level because each plan it could be different, but high level, what usually would happen is if the fourth medical need is over $500, then it would be what we call shared with the community. So it gives you more predictability for your out-of-cost pocket of what you might be spending in a calendar year, a little bit more clear than insurance, which we have deductibles, co-insurance, co-pays, and then max out-of-pocket, and then throw it in and out of networks. And you don't know. You don't know. I've heard people get bills, a year or two after their surgery, they're still getting bills.
Oh, yeah. And you know, you go to the hospital for this emergency, and the hospital's in network, the surgeon's in network, but the anesthesiologist isn't in network. And they give you a medication that's not in network. So now all of a sudden, you've got these ridiculous charges that you have no control. You can't pick the anesthesiologist that's going to take care of you for your surgery. It's whoever's there when you go in. And half the time, even when it's elective, you don't know about the anesthesiologist. That's one of the things that I've seen people get caught with. You look through your plan, you find the surgeon that's on your plan, then bam, you're hit with the anesthesiologist because they're not
most
network.
They're contracted. And look, if it's an unplanned surgery, most insurance says, look, if it's an emergency surgery, you're just tied to your deductible. If it's a planned surgery and you got on network, then you're going to be responsible, and you would have to appeal, to, that you would, because if you look in your insurance, and this might be really good these are the top 3 things we've seen with people with insurance that just to be aware of when you're reviewing your policy is in and out of network caps. So it's really important that you do have a cap on your responsibility amount if you go out of network. It's your responsibility to know how much, if I do, have a surgery or see a doctor that's not in network, what the potential financial exposure is. The other thing that we found is ER visits. I was just looking at a plan right now that said you are responsible for the full amount of the ER visit.
Ooh. Ooh.
Yeah. Sorry, I take a drink of water.
That can be thousands and thousands of dollars.
Yes, it can run thousands and thousands of dollars. And I had one member who shared with me that they did have an unexpected 2 a.m. ER visit, and it was a $7,000 deductible that he had to owe for the particular ER visit. And I said, did you appeal it? And he said, oh, I can do that. Yeah, it turned out to be a sprained ankle, or it didn't cost $7,000 because you needed access for healthcare in the middle of the night.
Mm-hmm.
So what we see, we usually guide people, and if you want to stay on your insurance plan, know ahead of time what something could be so you're not so surprised, or you can explore and look for particular options that in ER visit, you might want to look for a dedicated copay, a copay of $250 for the ER visit, right?
Right.
Or a co-insurance of it's 80-20. Even that could be expensive if you have a $25,000 ER visit.
Exactly.
So you're going to owe 20% of that bill. Mm-hmm.
So now let's shift to Indipop because everybody's on the same page. Everybody's in alignment. They're wanting the best for the most economical cost. So when a person engages with Indipop, someone is working with them to help them understand what's going on. So talk us through when a person calls, what's the process? Because I think, I know that health insurance is such a challenge for most people, and it's not written in the most user-friendly way. And so, talk about what Indipop is going to do with that person when they engage because it sounds like education is a big part of it.
Yeah, so that is one thing when you work with us at Indipop. Not only do we help match you with the right option, but we are another resource for you while you're on the plan. We have onboarding that helps. If you can understand your benefits, the likelihood that you find value in your healthcare plan soars. That, if you really understand what benefits you have, then you can say, oh, wow, okay, I know what I'm getting for my money. And so that is an important factor of, we give you resource pages. We have videos you can watch. We can help escalate if things go off track. It's still healthcare. Let's not fool ourselves that this is magic. It's still dealing with this is just a plan in the whole healthcare system with billing and codes and okay. We got to go
time goes by so fast. We've got to go to break, and we'll be back shortly, folks. Hang with us.
Patty Conklin is busy, but she's never too busy for you, and there are lots of ways to get a healing session with her. You can even get one via Zoom or by phone. With 29 years in the business of energy healing, Patty has a unique and remarkable ability to connect with your energy to help you heal on a mind, body, spirit level. From angst to pain, you can get help from Patty. Book a half-hour healing session and embark on your own personal healing journey. Visit pattyconklin.com and click on services. That's pattyconklin.com.
If you're looking for unique items at affordable prices, then you should try Dream Product. From apparel to beauty, from shoes to therapeutic relief products, visit HealthyLife.net's advertiser page and click on Dream Products, and maybe your dreams might just come into reality.
Want to get that man or woman out of your mind? How about being in the right state of mind for getting that job promotion or staying positive to help boost your immune system? Want to break those old habits? Then it's time for an emotional cellular cleansing with Patty Conklin. You'll get a private 3-hour session in person, by phone, or by Zoom with 3 months of follow-up appointments, plus email support. But you'll have to do the work, and homework materials are included. Find out more or to book your appointment, visit pattyconklin.com. That's pattyconklin.com.
Get high-quality glasses, sunglasses, and prescription lenses at eyeglasses.com. Choose from over 250,000 items and 400 brands. Already have frames? Get replacement lenses. It's easy. Go to our advertiser page and click eyeglasses.com.
If you're wondering if Patty can help you heal, why not book a free 15-minute consultation either by phone or by Zoom? It's a great way to see which of Patty's services is right for you. You'll discuss her services in detail and how they can apply to your specific situation. It's really a great place to start, and you can sign up for your free consultation by phone or Zoom on Patty's website, pattyconklin.com. That's pattyconklin.com. Get the help you need today. Sign up for your free consultation at pattyconklin.com.
Radio your way. HealthyLife.net.
We are coming back for our last segment. The time flies so fast. Melissa, you were starting to talk about the different features that Indipop and healthcare exchanges have, because that really help people understand what their options are, what's going to be the best plan for them. And then after they're enrolled in an exchange, there's even more support. Can you, let's spend this last segment explaining to folks, that they're not in it alone, and they have an advocate to help them navigate this system. So talk about that, if you would.
I think, many of us, if we've used insurance in the past, we know the process. You sign up, you get an ID card, you figure out your network, and then you're on your own. You're just trying to figure it out. You'll call it, I know I have to have surgery, let me find out what my benefits are. But the healthcare system is very complex. And you have doctors' needs, patients' needs, like doctors too. They have insurance so that they can accept insurance so that their patient can come see them. But the doctors have to be reimbursed from those insurance companies. There's paperwork involved. There's reimbursement rates. It's very complex. And when you're doing this, on your own, trying to figure out when the healthcare need comes up, it can be very daunting. And it's very daunting also to read a policy and to not know what to look for in that plan. Like, you might look at the premium and go, I can afford that. And then you don't know the rest of it, what potentially could happen if you do have a dreadful disease and what may happen. So we're here as advocates and a resource to kind of educate and explain a little bit more deeper into healthcare, how some things work, and if Indipop, our memberships are an alternative, which one might be the best fit for you. And these particular memberships do have that medical advocacy that comes with the plans. They have membership services that they can help you find the discounted labs or the imaging center to go to, or, which pharmacy might have a particular medication cheaper, or can we go direct to the manufacturer to get it? These are options that many of us don't know that are out there because we're so used to just getting the ID card and following what's in that particular network, and that's it.
Yeah. Yeah. So there's actually someone to call that actually has your best interests at heart and will work with you to get the best for you. And that's like you said, it's putting some care back into healthcare and not just, get your card and then you're, roll the dice, you're on your own. The other thing is that, we're all on the same page. In the traditional setting, it just seems like there's such adversarial relationship with it. Certainly as a physician, I had an adversarial relationship with the health insurance company that didn't want to pay me for my work. So that really got old. I think this is a key difference, that the actual exchange is working to help you find what you need. I had never heard of going direct to a drug company except if it was some experimental something or other. Going direct to a drug company to get the best price on a medication. And certainly... and you certainly didn't have the insurance company trying to find you the best price on your medication. And as you said earlier, sometimes the copay was more than what it would cost to pay for the drug out of pocket, which makes absolutely no sense. But, that's something that people can do right now. When they go to the pharmacy, say, what's my copay? Well, how much would it be out of pocket if I just paid for it? And you might be surprised that, certain drugs, will cost less, which really begs the question of, well, is the insurance company really looking out for you if the copay for your drug is more than what the drug costs? It makes no sense.
Well, I don't think they're looking out for you. For a for-profit company, how do you make profit? So it just goes back to, healthcare it's a massive system, and the top question we get asked every day is, how can I keep my provider? And that relationship with your doctor is so important. And doctors don't want to lose patients to networks that change every year, right?
Right.
And that's confusing too. It's confusing for a front desk of a doctor's office to be constantly explaining, or, it takes up a lot of time and everything. What the nice thing about our memberships through Indipop is, in most cases, doctors will get paid the usual and customary rate the day of the, let's say, the visit. Or in some cases, in some of our plans, they reimburse in 45 days. Cash flow is a big issue for independent practices. And to have that cash flow and be paid and not have to go through all the paperwork, it's boom, my patient came, they paid the cash pay rate, and it's done. The money's in the account, the patient got the care that they needed with the provider that they wanted to go to, and it's a win-win. It's a win for the providers, and it's a win for the patient. The continuity of care is such a huge factor because your doctor, especially a family practitioner, can just look at you and go, she's not smiling today. I know Melissa. So what's going on? When you're going to a new doctor every time, because of your insurance, it can be very jarring, and they can miss something. They don't know you.
Right.
I'm sorry. Right. I'm speaking high level and from my own personal experience. I hope I'm not, but it's true.
No.
My doctor really knows me. They know me. Yeah.
Yes. No. But this is an important point because I know when I had my practice, every year people were getting different insurance. So they'd come to me, and then the next year they'd go somewhere else, and then the next year they had different insurance, and they'd come back. And that wasn't serving anyone. And as a physician, if you can, maintain your population of patients, and they're not flopping back and forth, then you have stability that you can count on. And to be able to get paid know that you're going to get paid in a few days and not have to call and constantly chase your money. I mean, I was one doctor and I had 7 full-time staff, and 2 of those people spent the majority of their time chasing down payment from the insurance company when it's ridiculous. And, and it's difficult to run a business in that way. When you're doing the work, later you're waiting to get paid. So thank you.
I don't think doctors went into med school to do that. Yeah.
Yeah. Thank you so much for joining me today.
You.
I think that this is really informative for folks out there. And it's indipop.co, correct?
That's correct. INDIPOP.co. Yes, that's correct. Thank you.
Yes, and go to the website, check it out, call, get yourself educated, compare what you're paying now with what you're getting, and compare that to an exchange. And particularly if you're, anybody, but particularly a small business owner, self-employed person, this is a way to get care back into healthcare and to make your dollar really work for you. So thank you, Melissa. I appreciate your time so much.
Thank you.
And you stay well. And folks, we'll be back next week. It'll be Martha Boone, urologist extraordinaire, and she'll be talking about common urological issues and what you can do for them and some important things to know about them. So take care and stay well.
Thank you.
You've been listening to the Patty Conklin Show on HealthyLife.net radio. To listen to it again or share it with a friend, visit HealthyLife.net podcast on demand link on our homepage and click on Patty Conklin.